It is also commensurate with the fact that it is the largest number that we have tested also in a single day. Out of those 22, 13 are male and 9 are females. Let me also add that 21 out of the 22 cases are people who are currently in quarantine. And that tells you the importance of the exercise that we have been carrying out. And that it is lucky that we have found the 21 people in quarantine, because by now the 21 would also have passed it on to other people. And one case is in Mombasa hospital. You'll be getting the statistics on all this in the leaflet that we are going to give you. There are 18 Kenyans, 2 Pakistanis, and 2 people from Cameroon, 2 Cameroon nationals. And that makes up the number of Kenyans we have now. In terms of county of origin, now please note, these are not people who are in those counties. These are not people who have been tested in those counties. And these are people who have not arrived in those counties because they are in quarantine. And they are quarantined as they came through the airport. So, Kakamega County, the residents are as follows. Kakamega County, 1 resident. Kiambu County, 2 residents. Kilifi County, 1 resident. Machakos County, 1 resident. Mombasa County, 7 residents. Muranga County, 1 resident. Nairobi County, 1 resident. Nyamira, 1 resident. And international, the 4 that I have said, from 2 each, from Cameroon and from Pakistan. Ladies and gentlemen, fellow Kenyans, over the last 24 hours, 810 Italians have passed away. During the same period, 812 Spanish people have passed on as a result of the coronavirus disease. What this tells us is that we cannot emphasize enough what is likely to be ahead of us unless and until we adhere to the rules that we have established. Distancing, washing hands, and observing strictly what the government is saying. I would also like to add here that this disease knows no boundaries, not national boundaries, not political boundaries, not between rich and poor. We are all affected in the same way. And that is why I would like to persuade our leaders in and out of Parliament that tafadhali, when you speak to this issue, don't speak in a manner that brings division. For example, the acting DG is misquoted today, and he speaks for himself, as having said that he didn't know that there was a multi-agency activity going on, as if there is a division between the arms of government. I would like to state very, very clearly, there is absolutely no difference. This is a total government effort. The leader of all of us is the president, who is guiding us through this whole process. The transport ministry is involved in matters transport. The police and the security authorities are involved in tracing. When it comes to tracing of contacts, and we are tracing thousands of them now, when it comes to tracing of contacts, the Ministry of Health does not have the capacity to trace contacts. The Ministry of Health accompanies the agencies that are assisting the Ministry of Health to trace the people. So if you get a visit from another arm of government, then you cannot say, that is not to say that the agencies are not working together. As a matter of fact, that is a demonstration that the agencies in government are all working in unison and in a manner that indeed has not happened in a long time. We are working very well together. So it is not true to insinuate that there might be gaps or differences. There is not, and there is none. I would also like to say, this morning when Brenda and Brian were talking to Kenyans, they also emphasized the same. And they said that they were grateful to the government, and the president especially thanked the little girl called Brenda, because she is the one who brought herself to Bagathi, and because of her, we have been able to track and quarantine people who now have been spreading the virus. So I would just like to say, and to echo her as a hero, as a Kenyan hero, to say if everybody took similar responsibility, quarantine yourself if you know you have traveled, because so many cases are out of people who traveled, who are asked to quarantine themselves, and they did not. And just because they are not feeling well, they decided they have they don't have the virus. So I would like to urge, please quarantine yourself if you have been traveling. Quarantine yourself if you begin to feel that you are not feeling well. Quarantine yourself until you get help, or at least until our officers are with you. Finally, ningetaka tu kuzungumza kidogo mambo ya hao Wakenya wawili ambao leo hii daktari amesema wako sawa kabisa, wamepona na wako katika pale walitoka, wako kwao nyumbani. Na tunashukuru Mungu kwa kutuhurumia kama Wakenya, kuhurumia hao watu wawili, na tunafurahia hiyo maneno. Rais mwenyewe alifurahia hiyo maneno sana leo katika na kuzungumza na hao wawili katika mkutano wa video, na vile vile Wakenya wengi wamesema vile wamefurahia hiyo maneno. Lakini hii ni kusema nini? Ni kumaanisha ya kwamba tukifanya vile serikali inataka, tukifuata maagizo na maelekezo ya serikali, basi ienda ikawa tunaweza kusaidia Wakenya wengi, tunaweza kuokoa watu wengi ambao ienda wakafa, kwa sababu hii virusi iko hapa. Hii virusi inaua watu wengi sana katika hii dunia. Tangu wakati huu watu karibu 12,000 wamekufa kwa sababu ya hii virusi. Kwa hivyo sisi tukiona vile watu wanaangamizwa huko Ulaya, sisi pia ni lazima tujikinge. Tafadhalini wenzangu, ni lazima tujikinge ndio tusifike hapo pahali ambapo kila siku tunasikia watu 800, watu 900, watu 700 wamekufa. Jameni, washa tufuate maagizo ya serikali, tusije tukafika hapo. So I want to thank you all very, very much, and to just add that as on the matters of coordination of government and on the issues of taking care of the wananchi, that food trucks, just like CS Munya said yesterday, that we have not stopped commerce because of the curfew. Food trucks are free to move in the evening, and the police have been advised the same. There are also vehicles moving across the border. For example, vehicles moving food and other items and medicines from Mombasa, the port of Mombasa, heading for neighboring countries. You know, so that is still going on. What we are avoiding is contacts in the evening in a manner that can reduce social distancing. So I am thanking those who are continuing to observe the curfew. I am thanking those employers who continue to release their people on time. And I am thanking those employers who continue to support, you know, Kenyans and employees who have supported the companies that they work for many years and for a long time. I'm also thanking the business community for being part of this effort to support government. I am thanking the donor community, the World Bank, the World Health Organization, UNEP, UNON, and all the others who are working with us, the Clinton Foundation, and all other organizations that are currently working with us to increase the supply and readiness for what we can see coming at us ahead. So I am just asking for unified effort and to say that Kenyans, when you are in a ship that is going towards a storm, you don't start arguing or fighting within the ship. You get together to hold on so that you can weather the storm. I thank you.
Thank you. Okay. I am Mark Namaka from KTN News. I have two questions. One is about the report that we got yesterday concerning the...
Mark, you have to speak a bit louder.
Yes. Okay, I'm Mark Namaka from KTN News. I have two questions. One is about the clinical officer and the spouse that we got information yesterday that they had been tested positive. And number two, the issue of water in city estates, given that this is a critical commodity in the fight against COVID-19. What happens to city estates that don't have water, like, what is it called? Yeah.
Okay, I'm going to respond to one of them, which is about the water in the city, and leave the other one to Dr. Amos to respond during his technical response. As far as water is concerned, there are three things happening in the city. One of them is that we are aware that there are very many private sector people, including the Kenya Pipeline, that is working towards supplying of water, particularly in populated areas. That's number one. We have also asked that we are also aware that the national government, through the Ministry of Water, is supplying tanks, is supplying water points, again, in almost everywhere, including the highly populated areas. We have also asked that at this time when people are going through the kind of difficulties that they are going through, that people should not be disconnected because of water bills. So if there are people being disconnected because of water bills, we have asked the city not to disconnect to people because of water bills. If there is a shortage of water because of a burst pipe or something, that is a different matter and is an issue that can be handled and repaired. We are also asking KPLC. We are not saying that if you are able, you don't pay, but we are also asking KPLC, tafadhalini, when people delay a little bit paying, you know, mutuonee huruma jameni, muonee wananchi huruma, you know, so that you can also, you know, ease the pain that they are going through. We are also saying, Mark, not to sideline your question, but just to write on it, is we are also saying that even those in food distribution, not to take advantage of wananchis by increasing food prices when they don't need to. And as I said earlier, when it comes to certain things like food and medicines and sanitary products, also sanitizers, we have said if you increase the prices, we have got a method of dealing with that. It's oversupply. When sanitizers became too expensive, we oversupplied. even giving them for free. So reducing the price. So we are saying food movement is allowed even during curfew. So there is no need for food prices to go up. I'll let Dr. Amoth respond to the issue of the clinic officer.
Thank you, Waziri. Let me start by clarifying again and re-emphasizing that at no point did the office of the DG insinuate that there's no multi-agency approach in the fight against COVID-19. Indeed, we have emphasized over and over again the multi-agency and the whole society approach in this fight. Regarding the case of the clinical officer who is currently admitted at the isolation disease unit in Bagabi, yes, it is true that this healthcare worker attended to a patient who had traveled from Nigeria and later developed symptoms and was quickly screened and tested and of course turned out positive. She is responding very well to treatment and we are hopeful that she'll make a full recovery like the 2 cases that we have reported today, this morning. Thank you.
What is the word, sorry? Current condition. Okay, I can respond to the issue of the French national. The French national did go back to the country, and there are also evacuations, as you are aware, of other people from the country, from other nationals who are also evacuating to their own countries. I'll give you a chance. Yes. No, sorry. You can respond to me.
Okay.
Yes, please. Sorry? Thank you very much. On the issue of the face masks, you know, not all face masks that are being made are worth anything. You know, I suppose it's better than nothing. It prevents dust. You know, it prevents dust from breathing dust. But the truth is the matter is that we now have capacity of making approved masks in the country, face masks. I know that the Kitui women's, what is it? What is it called? Kikotech in yesterday, I know that Kikotech was approved to make face masks in the country, but we shall continue to make as many as we can in the country, but also add whatever we can from the country. We are also getting donations from elsewhere around the world. So I'll let my colleague answer that one. As far as the budget is concerned, you know, we are looking at all avenues of funding, of moving monies to be able to fund this issue, including how to support the vulnerable groups and vulnerable people in the country. We have not currently, reallocated any specific budget, and we are not looking at any specific budget for allocation. Now, when it comes to a crisis, there is no budget that cannot be reallocated. I'm just saying it has not happened, as far as I know, because we have had sufficient support from the international community. The government itself has put in its own money, and we continue to get support from various quarters. Only yesterday, the World Bank was approving a line today. Is it today, the 2nd of April? is tomorrow. Is it tomorrow? 2nd of April. You know, I've lost track of yeah, tomorrow they are approving a line of credit of another $50 million. So it is not that we have ran out of money for this purpose. The problem globally is shortage of materials, not really money. At the moment, the world over, the problem is shortage of materials. Let me let my colleague also respond to that particular question.
Thank you, Waziri, again. All the patients are doing well, except one who is in the critical care unit at the Aga Khan University Hospital. But his condition is also improving. Indeed, in the next 2, 3, 4 days, we should also be able to come back to you to announce that potentially there's another patient who could be declared as having been cured of COVID-19. So all the patients are doing well. It's only one who is in ICU on ventilatory support, but is responding very well indeed to treatment. And we are in constant touch with our colleagues at Aga Khan Hospital to monitor his progress as he undergoes his treatment. Thank you.
Final one, please. Sorry?
My name is Gloria Milimo from K24. Now, as of yesterday, the clinical officers expressed concerns in regards to whether their members are fully, adequately equipped with the knowledge on how to handle this virus. And then again, they were talking about lack of adequate protective gear for their members. So they were asking what the government is doing in terms of just assuring the members of their safety. Yet in the recent past, through the press conferences, you've been telling us that we are fully equipped, and then those on the front line are fully equipped with the gears, protective gears.
Thank you.
What do you have to say about that?
Thank you very much, Gloria. Two things. Number one is that we will not expose our medical workers. And at the moment, anybody facing any patient, any suspect, anybody going to do any tracing is in medical gear. The shortage, of course, the global shortage of PPEs has also been a problem for us. But I am also glad to say that probably by end of day tomorrow, we are also going to start manufacturing PPEs here in Kenya. So that is going to deal a it's going to be a breakthrough for us. We are just waiting for the approvals because of the material that is required for doing so. But once that happens, then even the shortages we are experiencing because of global demand are also going to reduce. So our intention is to make sure that they are properly protected. Now, as for training, let me tell you something. We have got extremely well-trained nurses. Extremely well-trained nurses in this country. And therefore, the training we are talking about is not from square A. We are simply talking about them being training for adoption to this particular disease. They have been dealing with very many other infectious diseases, particularly TB, as you are aware. So it's not the first time that our people are dealing with a challenging state. So, as I conclude, let me just say to Kenyans, 81 of us are now positive. 81 people. Growing that exponentially, if you have one person affecting so many people, then you can understand that there is a very high chance that the person next to you has also been exposed. Keep your distance. Thank you very much.
Sir, kindly, allow me to ask this one question, kindly. My name is Purity from KBC. You began your statement by saying the virus is widely spreading in the country. That means there is no breakthrough into controlling this. And we've seen from even China or even other countries that have had rapid spread of this virus calling for a lockdown when such cases are experienced, maybe you can tell us what's the plan for the country. Number two, for the people who are recovering or receiving treatment, what mode of treatment are you using for these patients?
Let me oblige you by saying that, you know, we will take, as the President said this morning, there is nothing that is not on the table. But there are certain very serious preparations. Before you take a step, you need to prepare substantially for any step that you want to take. And we will not make steps irresponsibly, so to speak. We owe a responsibility to Kenyans, particularly those in vulnerable areas and particularly those in vulnerable groups, to ensure that we protect them under any circumstance. So let's just put it this way. Let's say that as we watch the situation and what we have seen, Kenyans should prepare themselves for stiffer measures that the government is going to take, because we cannot, as I said earlier, we cannot behave normally in an abnormal situation. Let's observe, for now, let's observe what we are supposed to observe seriously. And let me also say this. You can go into a so-called lockdown and just be speaking about it. If you lock down people, 10 people in a room, and you have got one infected person, and you are talking about locking those people in, all you are doing is spreading the virus among those ones that you have locked in. So you must think through, you know, what you are doing. And every country has got different circumstances and act differently. If we do what we are supposed to do, lockdowns come because people are not doing what they are supposed to do. Because if you are keeping social distance, if you are keeping away the distance you are supposed to, then it will not be necessary. But it becomes necessary because that is not being done. I'll ask my colleague to answer the other question.
Thank you once again. This being a viral infection, there's no specific treatment. The treatment we offer as clinicians is basically supportive treatment. Supportive means we respond to the symptoms that you exhibit as we take care of you. Like if you have a fever, we give you something to bring down your fever. If you are coughing, we give you something to suppress the cough. However, there are very many trials that are being undertaken as we speak, and the most quoted is of course the use of hydrochloroquine and an antibiotic called azithromycin, which is locally available. So all those medicines are at our disposal to be able to deploy for cases which require them. For example, the current patient who is admitted in ICU in Aga Khan is actually on chloroquine and azithromycin and is making good progress. But because this is just a single statistic, we cannot be able to say that chloroquine and azithromycin works for COVID-19. We require a bigger sample size so that it can be statistically significant for us to say this treatment works for COVID-19 and this one does not work. Thank you.